So with the electroequiscope, what they discovered, I guess decades ago, there were a couple of German scientists who discovered that if you introduce current into the body at microamperes using a conductive agent, that it not only enters the ion channels, that it goes into the cell. So at the cellular level, we're changing things. We're increasing the circulation, we're decreasing the inflammation, and we're increasing the production of ATP, which is basically our cell's lifeblood, by up to 500%. And so this is pretty incredible, and I thought, that sounds pretty outlandish. So I did research on my own with microcurrent in general, and this is with microcurrent in general, this is what they've found in research studies. And these are Johns Hopkins research studies, Mayo Clinic research studies. So they've found that this is what it does. It increases the production of ATP by up to 500%. So now when your cells have that ATP, they can actually start getting better. The machine is not what's incredible, which the Equiscope is pretty incredible, but it's our body and the way that our body heals. It's incredible. So if you give it what it needs to do its job, it will do its job. So I like to tell patients that they're not going to feel anything. If at the most they might feel a mild tingle. Anything above that, the settings are too high, and we need to just turn them down a little bit so that they're at a comfort level, so it's comfortable. I think the hardest thing to overcome with explaining this to people is that because they don't feel anything, it's hard to explain that it's working. So they think, like for example, with Dr. Amen being my first patient, he would say, it's okay, turn it up, I can handle it. But really, we don't want to turn it up to where we're feeling the shocky type feeling, if you feel it at all, because that's where it's not working. We need to kind of get it just below that point. We want it where it's just comfortable. So I think that's one of the biggest things to overcome. People don't feel it, so they don't think it's working. But when you use the machine and they have pain, it's hard to dispute that you're going from a level 8, 9, 10 pain to a 0. I mean, people are amazed. I'm amazed, and they're amazed as well. And so once you have that treatment, the typical reaction is going to be that they're going to feel better, usually that day, up until the next morning. An atypical reaction, it might not last as long, but we know that if it can take away the pain at any level, that it's working. It's just going to take time, and it's going to depend on how their body is going to react to it. So that's another thing that's hard, is being able to tell. You can't tell patients, with other treatments, you can say, okay, if we do this surgery, this is going to happen. It's going to take about this long, this many months. If we do this, if we take this medication, it should take about this long. But with the Equiscope, it just depends on their body and how well they're taking care of their body. So we ideally are asking every patient, do they want to get better? And having them tell you, yes, I want to get better. We're making sure that they're hydrated. And ideally, we know how hard it can be for some people to stay away from sugar, but I do like to tell patients that while we're doing the treatment, just for the amount of time we're doing the treatment, to try to stay away from processed sugar so that they're not adding inflammation when I'm trying to take away inflammation, to help put their body in a good environment for healing.